All right. Thank you, everybody, for coming back on time. We have a real treat now. For about an hour, we'll have a legislative panel update. So I'd like to introduce Senator Charles Schwertner.
Hello, everybody.
Here with us today. State Representative Marsha Farney. And then Josette Saxton from Texans Care for Children, who does a lot of work legislatively with mental health issues and youth issues, and she'll be moderating for us today. And she's going to do some further introductions.
Good morning. Good morning, everybody. I'm so excited to have a room full of folks that are here thinking about children's mental health, mental well-being, and especially within the school system. And I just want to personally thank all of the folks that have come together to do this great work to make this happen. I'm also very excited to be up here getting the opportunity to speak a little bit with some of our state policymakers that are doing some great work here in the state to make sure that communities have the tools that they need to help promote their children's mental well-being. I just wanted to, provide a little bit more background information of our speakers. Dr. Marsha Farney was elected in 2012 to represent District 20 in the Texas House of Representatives. Her districts consist of Burnett, Milam, and the northern portion of Williamson County, including Georgetown, the county seat, and Sun City. Currently, she serves as a member of the House Public Education, Judiciary, and Civil Jurisprudence and the Local and Consent Calendars Committee. I think also noteworthy is her background in education, serving as, which also enables her to serve as a counselor and a principal. Dr. Senator Schwertner is a physician, family man, business owner, and lifelong conservative. In 2010, Dr. Schwertner was first elected to serve on the people of the House District 20 in the Texas House of Representatives. And there he quickly earned a reputation as a measured and effective legislator, working with his colleagues to pass one of the most conservative legislative agendas in Texas history. In 2012, he was then elected to serve as the senator for Texas Senate District 5. And what I will also say, too, we'll probably hearing a little bit more about later, really championed getting some good legislation passed to help schools better identify and know what to do when they suspect some mental health concerns with their students by facilitating mental health first aid training in communities. So I just want to both say thank you, welcome for your leadership. Thank you for your leadership. I want to start off, the discussion, by asking, both of you, do you have a personal interest or a professional interest in children's mental health and well-being? I think we'll start with you, Dr. Schwertner.
Sure. Thank you, Josette. Can you all hear me okay? Okay, good. Again, I'm Charles Schwertner. I'm State Senator for Senate District 5, and it's an honor to be here with you today. For those of you who don't know, the Senate has 31 members, and we have a very large geographic region. My district goes all the way out to Walker County, has 10 different counties, 39 different school districts, 262,000 children, 811,000 people. So a very large task to meet with a lot of different individuals and to represent them well at the Capitol. I'm married to Belinda, who's an obstetrician gynecologist. As you heard, I'm an orthopedic surgeon. I have 3 children, 11, 12, and 13, that attend Liberty Hill High School, Matthew, Zachary, and Carson. My background has been as a businessman and as a practitioner in medicine. I have 6 generations of roots here in Williamson County, farming and ranching roots, an unbroken line of farming and ranching. It's been an honor to serve you in the Texas Senate. I'm very proud of some of the successes we had, in particular in reference to mental health issues. I think it was a transformative session, and we'll get into that in a second. You asked if I had any personal background in mental health. Besides being a physician, I'm also a pharmacist. But my mother, in particular, growing up, she was a MHMR nurse as well as an inspector for the Texas Department of Health. And I can remember many times her coming home and telling me how blessed I am to have parents that care, to have the opportunities that are available in being raised by my mother and my father, and to not have to deal with some of the challenges many other children have to deal with. And sometimes she would actually cry when she said that. And I also grew up in pharmacies that my grandparents owned, and I got to see at a very early age some of the challenges of the people of Texas, serving them at the cash register and stocking bottles as a very young boy for my grandparents in their 3 pharmacies that they owned down in West Texas. So that's my personal background. In addition, my oldest son has ADHD, and he's on medication. He's on Vyvanse, and he sees a child psychiatrist and also a psychologist. So I have obviously some personal knowledge of that issue in particular. So that's my own personal story. Thank you.
Thank you. Representative Farney?
Good morning. Thank you for letting me join you today. This is very personal for me as well. As a former classroom teacher, I was propelled to want to move into the counseling field because of the needs I saw in my classroom. And it's unfortunate, but every year that I've taught and been involved with the public school, every single year there has been at least 1 or 2 incidences of children who wound up with mental health needs that became very evident. Not always acts of violence, but that's also been something I've experienced as well. I also, when I went into counseling, decided that the students that were at the disciplinary alternative education programs had no counselors. So I added to what I was already doing at my middle school and also as a high school to go start working with the DAEP kids and to want to treat them with respect, to help those students who were there to be able to get their work caught up and do that. It's been interesting. I've actually been even, because of that relationship I have with students, though, I've been surprised to see, even when officers were trying to wrestle one of them to the ground and they bumped into me and I wound up on the ground, the young student, the young gentleman was like, "Oh, miss, I'm sorry, are you okay?" So by having that relationship with him, I was still able to work with him, even though I was alarmed, I was being thrown against the wall. But I will tell you, it started off professional for me because of being their teacher and then as their counselor. But it's become very personal to me because if a student's well-being, their mental health is not addressed, they are not going to be able to succeed as well in any other area in their life, personally or academically, and certainly not as adults and young adults out in the world. So for me, this is a very important topic. It's one I'm very comfortable talking about. And I'm so pleased that you are here, and I hope we can be of some benefit to you. And also I look forward to working with you in the House and with our Senator Schwertner also to make sure we have appropriate laws. That's also then what propelled me to run for office, was realizing the importance of sometimes the people who are making laws didn't have the background that Senator Schwertner had or that I have. And when people are making laws and decisions about our public schools and about our children, I think it should be someone who has a personal investment in those issues and has personal experience, because as you know, it changes your perspective when you've been there and done that. Thank you.
Thank you. I think, both of you, served on committees where you heard a lot of testimony around mental health in schools this session. And I know there were some concerns that were raised of folks are saying, well, mental health or schools are not the place for us to be addressing these issues. We don't need to have our teachers becoming diagnosticians or diagnosing and treating kids. Which I would say is not something that was being sought and is not appropriate. But what would you say is the role of schools in helping to address students' mental health?
Sure. That is a topic of concern by certain groups and certain individuals that view schools just as a place to learn. But in this day and age, with the breakdown of the social structure, the nuclear family, and the social pressures that children are under, I think it's incumbent upon, and also with the recent tragedies at Sandy Hook and in other parts of our country, I think it shed a light on the need for at least awareness of mental health in our society. Mental health not only affects somewhere close to, I believe, 1 in 10 children. Maybe you can clarify that, but it also affects our criminal justice system and our hospital ERs. And so I think the more knowledge we have, at least awareness of it, the better we as a society can deal with it. And schools are part of the overall structure of our society. I passed a bill called Mental Health First Aid, and we'll get into that maybe in a minute. But that bill is not to try to make teachers or counselors diagnosticians or treatment professionals in mental health, but whether it's to try to increase the awareness of mental health in our society and realize and become aware of children that might be falling through the cracks and have a potential crisis or future potential crisis, so that can be averted in early intervention rather be the way forward in reference to realizing and becoming more aware of those children. That was the purpose of Senate Bill 855, which I'm proud to have authored and is now law. And I hope a lot of the school districts consider some of the options in reference to that bill. So mental health is unfortunately a growing problem, I think, in our society, and I think it stems back again to the breakdown of the nuclear family and some of the social safety nets, our churches and our communities, the extended family. And now all we have in some respects are our schools. And those are the safety net for some children.
Thank you. Representative Barney?
Well, given the amount of time that children spend in the schools, I think it is appropriate that teachers and counselors should be aware of clear indicators that there could be something really going on with the child. I agree completely. Teachers don't want to be diagnosticians, neither do counselors. But because we do have a need with, often we're going to be the ones that see some of the early signs. We're going to want to hear some of those conversations that may be a cause for concern or alarm, and to be able to get the student to someone who can appropriately help them to see if this is a situational issue of depression or if it's a clinical depression. That's a big difference. All of us will go through periods of time when there is a situational cause for depression, the loss of a loved one, disruptions in the home, things like that can happen to our children. But the situation that's most critical, I think, in our public schools to deal with, and we've had this recently even here in our area, is suicide with our children. And to act like bullying, which we've been paying more attention to, is just us, just kids. We've learned to realize that sometimes it gets out of hand, especially given the social media aspect of it as well. So while teachers and counselors do not want to be in the role of diagnosticians, this bill he just mentioned doesn't put you in that place. It just makes sure that law, and then two others that we have, I think I have them down as Senate Bill 460 by Senator Duell and 831 by Senator Taylor. Those are also bills that simply help us be aware of something when we know it's a little too much on that behavior. So it's awareness, and I think that's a good thing. So we will know then if there is something that needs to be done for those kiddos.
Can you speak a little bit from your expertise and knowledge and experience within the education system, the links between a student's mental health and their academic performance? You know, again, going to our school's mission are to educate and prepare our kids to become successful adults. So within your experience, did you see how a student with mental health concerns, how it impacted their academics?
Absolutely. Even if it were something as small as family disturbances during the night, which can cause the situational form of depression. But absolutely, many times when you see a student who is not paying attention, not doing their job, or is distracted or doodling or whatever they're doing in class, there's often a reason for that. And sometimes it's whatever it is. A student may be not paying attention. I know one time I helped a student, found out that the reason he wasn't paying attention is because his vision wasn't good. He couldn't see the board. So it could be something that's physiological. It could be something, though, that is a mental issue or psychological issue. I think there's a definite correlation between misbehaviors in the classroom or a lack of behavior that we expect in doing their work. So teachers, I think it's important that teachers in the university system now are going to be having extra training to realize this could be something more. Teachers should not be defensive or think, you're not listening to me. It's not a matter of being disrespected, and I hope teachers really get that. It's not about that at all. It's, how can I help this child? What is wrong? What is disturbing this child? And so it's not about me as the teacher. It's not about me as the counselor. This student is having some kind of a need, and it's being evidenced by either a lack of behavior or an inappropriate behavior, And from there, we try to figure out what it is. So definitely there's a correlation.
Thank you. And I know you've mentioned, I think we've touched upon some pieces of legislation that were passed this past session, again, to help schools, teachers, educators have the tools that they need to be able to identify, what are some of those red flags that indicate it might be something more, and then again, knowing how to appropriately respond. Again, touching on, there was some legislation that makes, and again, just that teachers that are, for their educator certification programs, that they receive just some basic information on what to look for and what to do. And then again, through continuing education for teachers in the school to have, just a basic minimum training of awareness that could be available online to know, again, those red flags. And we've also touched on, but then there's additional piece of legislation, of funding that is available from the state on having probably more intensive training, and that's the mental health first aid training. And would you like to speak a little bit more about that? I know we've touched on it a bit, but can you go into some more detail?
Sure. Let me just preface this by saying, in a lot of ways, this last session was transformative in reference to the Texas legislature and the state of Texas moving forward on mental health issues. We put into funding $350 million above what was appropriated last session for a total of about $1.7 billion across a lot of different strategies. We have our local mental health authorities, we have our state hospitals, and then we had a whole host of initiatives that tried to address some of what we thought were the cracks in the safety net of mental health. So mental health was a very large area of concern. I think it was a large area, if you remember and recall, some of the tragedies across our nation, a large area of concern across our entire nation, and continues to be so. And the Texas legislature acted. And I think this last session was a very productive session, not only just for mental health, but education in totality with HB 5 and the curriculum redesign and the change of the high stakes testing. And Representative Farney can go into that in great detail since she was on that committee. In addition, also, I think we moved forward as a state in reference to infrastructure, water, and transportation infrastructure. So I believe, and I'd like to say to you, that the state legislature, the state of Texas, is moving forward and I think working for the citizens and the communities and the children of Texas. In reference to the mental health first aid bill that I authored, it was an attempt to try to address some of what I saw was some of the concern of teachers and of community members, of the lack of knowledge of what mental health crisis was. It attempted to diminish the stigma of mental health, increase the awareness of mental health disease in our society, the prevalence of it, and to allow for interested individuals to find out the necessary resources for individuals that might be in crisis. That was the sole purpose of it. It is a voluntary training program that, again, does not try to make teachers or other individuals diagnosticians or treatment individuals, but rather fill in some of the question marks about why is this child acting a certain way? Is there something I should be picking up on to try to prevent a crisis in the future? Just as we have first aid for you would look at a child and if he had a big gash on his arm, you would do something about it. If there's a child's acting different and completely out of character, maybe he should be, do I just ignore that, or do I actually sit down with that child and say something to him and try to figure out what's going on? A lot of teachers, a lot of individuals are not for sure. Is it my role to do that or not? This is a way at least to develop some understanding, some increased information about those type of situations. That's what mental health first aid. And the program is administered through the local mental health authorities. In this area, it's Bluebonnet. I don't know if Andrea is here or not. I don't think she is. But it's a 12-hour course. It allows for the teachers to get continuing teacher education certification for free. If you're an educator, you can take the course for free. And it's I think a well-designed program that is evidence-based, and I think a positive step in filling in, again, some of the unknowns in reference to mental health disease particularly in children.
Thank you. And again, just going back to knowing that we can't, or I don't know if it's going back to it, but children's mental health and mental well-being isn't just a standalone thing. It really does touch on every aspect of a child's of ability. And within the school system, there are some things that also will impact their mental well-being. So I just wanted to touch a little bit on so looking at legislative decisions related to the school system as a whole, knowing that they do impact children's mental health. Can you talk a little bit about some of those things? You mentioned some of the HB 5, was it, and how some of the other legislation related to schools, some of the major things that were passed last session, and how it might tie into how well children can succeed.
Please.
This is one of my favorite things. This is House Bill 5, which is, I think, made a tremendous step forward in putting children's needs first. I definitely value, as someone who went through and got a PhD, I value education. But I guarantee you there are plenty of welders and mechanics and others who will make more money than I ever would teaching at a university. So to say that someone is only successful in a career if they have a particular degree, I think has been a mistake that we have made in pushing everyone out to become a doctor or a lawyer or a professor or whatever. I think we have shown value for all different areas of life. Often the very people who are the pillars of our community are going to be those who are entrepreneurs who start their own plumbing businesses or whatever other industries and businesses they have here. So I feel like HB 5, House Bill 5, honors that choice by adding much needed flexibility to where now we have 5 different strands or endorsements for students to be able to select. And the good thing too is that a counselor's not doing that for them, and the student's not doing that by themselves. A parent has to sign along beside the child selecting the strand that they're going to choose. And you can still have something very rigorous to prepare for, like STEM, you know what that is, science, technology, engineering, math. You can still have that. Or you can go into several different other areas, the humanities, the arts. There are 5 different areas now. One of the best things we did, though, in House Bill 5, too, was we reduced what I think started off as a very good thing. I actually supported No Child Left Behind in the beginning. I think we led the way across the nation with being able to assess where our students are and to be able to measure them and to show growth. We found out that we have very much needed to grow in areas with different minority groups. And since then, the minority, different group and ethnicity groups in the state have continued to rise. No Child Left Behind helped us see we needed to do something in those areas. But it got too big, almost like a river that gets out of its boundaries. It took over. And I can tell you as a classroom teacher also, I saw that it transformed teaching to where there were so many TEKS and standards to teach. It changed it much more into a reliance upon worksheets. I think I can get an amen from back here. I can see this. Say that. But it did, and it's unfortunate because teaching is such a wonderful art to be able to convey information in a way that the child owns it. And it can't be done that way for most kids through a worksheet. So what we did by reducing the test from 15, you were actually held hostage. Your diploma was held hostage despite what you do in the classroom. Until you took this independent test, 15 courses, you would not get your diploma. So what we did is we're holding you hostage for 5. And those 5 are reasonable. It's Algebra 1, Biology 1, English Language Arts 1 and 2, and American History. Those are all valid. Those are all important for whatever you decide to do in life. If you're going to go into the military, you're going to go get a certification to become a nurse or any other profession, or if you want to go get a 4-year degree and do more. This prepares everyone and gives flexibility for you also to go into the family business, whatever that may be. So that's basically what House Bill 5 did. It did a lot of other things. I was really pleased. Some of my standalone bills got rolled in. So my name's not on that bill, but my fingerprints are all over it. So I think that's really important, though, because teachers, the PTA was awesome because you had parents coming in and taking a stand on what they thought was important. And guess what? We listened. So that's what also I think is very important, is that you'll find, especially with Senator Schwertner and with me, we will listen. And we very much are here to learn from you about what needs to be done. And that's important if we're going to represent these particular areas pertaining for me, for especially education and things medically. I think that's important. One quick thing I want to say too that I think is important about mental health is just like we remove the stigma, like if you don't go to college, you're not going to make anything of your life, that kind of thought. Just like we remove that, we need to remove the whole idea about mental health issues as something, there's a stigma to it. It's no different than me having thyroid disease, which I do, and I take my Synthroid every day. Someone who has diabetes and takes their insulin every day. Whatever it is we have to take, we do it. Mental health issues, I know so many people who had adult onset of different kinds of mental health issues or disease that came up in college. If you're not careful, sometimes we look at that, we think, oh, it's rebellious, they're freshman, they're sophomore, they're doing this, they're doing that. And it's actually the adult onset of certain mental health issues. And I know many adults that are now healthy, successful parents, have their own businesses, who every day take their medication because they're bipolar. And no one else would know that if they chose not to tell you. But I've known some who, I knew them when they were leaving high school and going into college and have kept up with them. Mental health issues can be addressed. It takes time, it takes patience, it takes a good relationship with your doctor, it takes support from us. So when we find someone who has a mental health issue, I think our place is to be supportive and help remove and diminish the stigma. We can't get assistance until we admit what's going on, and then we pursue whatever it needs to get us the help we need.
Thank you. And I just want to say I'm going to put my parent hat on. No, my daughter is 10 years old. She's in 5th grade. And she already speaks of the stress. She gets stressed out by school. And there's already this awareness of the testing that, that they could tell that the teachers are stressed, they're stressed. And I was able to tell her too. It's like, well, it didn't affect you this year, but in future years you won't be required to take as many tests. So again, I could see with the whole testing issue how it affects students' well-being. Again, not talking about maybe a diagnosable disorder, but just that general level of stress that our kids are experiencing that could be preventing them from really getting all we want them to get out of school, as well as the ability to let kids do those things that they want to study and the things that they want for their career tracks. Again, keeping them more engaged in school so that it's allowing that flexibility to really meet them where they're at. So I definitely see those initiatives as really promoting our children's well-being, our students' well-being, and their ability to succeed. I also just wanted to mention, too, you were saying about the onset of mental illness. I know for kids, yes, 1 in 10 kids will have studies show will have a mental health concern that is significant enough that it will severely impact their ability to function at home, in school, with their peers, in their communities. But yet 1 in 20 1 in 5, about 20% of our kids will have a mental health concern, a diagnosis or a disorder. They might still be able to function, and get through. But again, mental health issues are not uncommon. But like you said, Representative Farney, they are treatable. Unfortunately, there's a long time between when symptoms will emerge. And I'm going to blank on the number now. About half. It just came to me. About half of the chronic diagnoses of mental health will start by the age of 14. They might not be recognized as such, but for adults that have chronic mental health issues, if they go back, they can see some of the things starting. About half of them start by the age of 14. When you get up to age 24, it's 75% of chronic mental health issues start by the onset of age 24. So again, this goes back to if these things are happening and we're not identifying them as such, or we're just writing it off as, oh, it's just kids being kids, or they're misbehaving, we're losing that opportunity to get them treatment when I think it is most effective. And it also helps them alleviate that suffering. So I just wanted to throw that out there. One thing I would like to ask both of y'all too is, during the past session, did you vote for or against increased funding for Texas public schools? And could you explain why you voted the way you did?
Well, I voted for SB1, the state budget, and that increased appropriations to schools by about $4 billion. Not quite, but close to restoring some of the cuts in 2011 session. I was on the appropriations in the House, having to make those difficult decisions. They were not painless, but I think they were necessary. Texas has been a beacon of economic opportunity for the last decade in reference to the rest of our nation. We are 8.1% of the population, but our GDP percentage is 11% of our country's GDP. It's an amazing statistic if you think about the amount of productivity of the citizens of Texas. And that's because, in my opinion, Texas has maintained a very fiscally prudent budget, has led in ways such as judicial reform, lawsuit reform, taxation reform. Those areas matter to individuals that want to start a business and create jobs and promote the economy. So education is one piece of a thriving society, but also laying the groundwork in reference to the policies of how we treat those entrepreneurs and those individuals, those businesses that are paying the taxes is also very important. And so I'm proud of the fact of what we had to do, and we did. And I'm also proud of the fact of what we did this last time, which was increase during the time of more economic prosperity, increased sales tax revenue, increased oil and gas severance tax to some of the critical long-term needs of the state, which includes education, but also includes infrastructure, water, as well as roads in particular. One thing I'd also like to say is that our oil and gas industry here in the state of Texas is been a remarkable growth engine for Texas and for our country. Just 5 or 6 years ago, we were only 36% energy independent as far as the amount of oil that is utilized in our country. We utilize about 21 million barrels of oil a day, and we're only producing about 7.5 at one time. Now we're about 60% energy independent, and the projections are we can become 100% energy independent. That is an economic opportunity and also has significant worldwide geopolitical changes as well. So Texas is leading. Texas works. Our legislature works for you, the citizens. And there's a whole host of things that concern me as a senator. The immediacy of what we do for the children of Texas, for the education of Texas, but also long-term what we're doing as far as laying the groundwork for our continued economic success.
Thank you. Representative Farty, do you want to add any thoughts too about the budget of our education system in the state?
I was pleased to see money be restored back to that. I'm really also thankful I wasn't in the House at the time they had to make those difficult decisions. And by the way, they had to operate off the budget that the comptroller set out. So that's what they had to operate on. So, but having said that, I do believe that when we do have, like in some school districts I visited, where they lost counselors or they lost different people, different aides in helping them, I think it's kind of like the drought. You have to wait a couple of years and see if the tree's going to die or not. And I think we'll be able to see in the second year and a third year to see not having enough counselors sometimes, and that's a district choice to do that. So, and it is difficult when we have to have budget cuts. But there's a price to pay when we have to do that. So I think it's important that we maintain as much as possible those counselors also to be able to deal with that. And as also, as a counselor, I can tell you, I think it's important that your administrators let you be a counselor and not be an administrative assistant, but actually to become, I think I had another amen just then. But that's important that you actually are doing that important function and that role. Students perform better when you have a good counseling program, not someone else who comes in and presents something they haven't lived with and know. So yes, I supported the funding going back, and I agree with the Senator. It was important to put that as much money back as we could, and I think we did well by the state of Texas this year for our public education to restore that.
Great, thanks. You mentioned, too, about how both of you very much listen to your constituents. You listen to the people. And would you have any tips, or what are some opportunities that for folks in the room if they wanted to communicate their thoughts, their ideas, or their concerns with you?
I welcome your comment. In fact, over here, would you raise your hands? This is Chris and Aaron. Don't be shy, because they're going to get you should all get to know them. This is my district director is Chris, and Aaron's my chief of staff. We actually have an office here in Georgetown, and we're open every Tuesday and Thursday. I'm actually there probably 4 or 5 days a week, but they're for sure there also 2 days. And we take phone calls, we take emails, we take love letters, anything you want to send. But we haven't had one of those yet, by the way, so you could be the first. But we are here to serve you. And I truly, that was one thing that inspired me also to go, was knowing the type of leadership I think we have here in Williamson County. To me, I was so impressed. They do listen and they do care, and I certainly want to be a part of that as well. So communicate with us. We're easy to find. We have cards. We will share those with you. I will say, I count on you as being my partner. I had a wonderful experience this past year serving on the Public Education Committee because I worked a lot with Georgetown Independent School District's leadership, including Scott Alarcon, as a school board member, including our superintendents. And I picked schools that were from 1A up to 5A. I made a mistake one time. I didn't realize it was a Sunday morning, and we had all these bills going through, and I called the Jarrell superintendent, and it was during Sunday school. And he answered my phone. He stepped out and took, so I said, how's this going to impact, Jarrell ISD? So I will contact you. If you want to risk giving me your name and number, during session, you will be contacted. And also during interim charges. It's my desire to serve you and to serve you appropriately, to serve our children, meet their needs. I cannot do that alone. So I need your help. So visit with any of us.
Great. Senator Schertner, what is the best way for folks to contact you?
Well, I have two of my staff members here, Tom Holloway, my chief of staff, and Nelson Jaron, who is my health policy expert and policy director. I have a number of offices, the Capitol office. I have an office here in Georgetown, then I have an office in Bryan, Texas. And I have a few more staff members in Marcia because of the larger geographic region that we. As far as mental health issues, the Sunset process is starting. I'm on the Sunset Commission. For those of you who might wonder what that is a commission that looks at our agencies, our regulatory bodies, on a rotating basis. And this session, or this upcoming interim charges for the Sunset include the Health and Human Service entities, including the Department of State Health Services, which has essentially all the funding for and programs under review that have to deal with mental health. And so I'm honored to be placed on that. I have a keen interest in mental health, but I also have a very keen interest in moving Texas forward in all sorts of ways, including getting our healthcare costs under control. It is now 30% of our state budget. $58 billion out of $197 billion biennial budget is dedicated now to health and human services. 2001, that's 30%. 2001 is 14%. So you can see the almost exponential growth of the percentage of the budget dedicated to health care. It is something that needs to be addressed at all states, and of course, obviously in our federal government with Medicare and Medicaid and Social Security and large-scale entitlements eating up a larger percentage of the federal budget. We review all these agencies. We try to find efficiencies and make sure they're working appropriately for the people of the state of Texas. And if you have any input as to any of the health agencies in particular that you'd like me to know about, please get in touch with my offices or me directly. Those include the Health and Human Services Commission, the Department of DADS and DARS and DFPS, and of course the Department of State Health Services. So.
Thank you. I also want to add a little, pitch here too, is saying that, y'all are covering a lot of issues. You touched on this a little bit. I guess we're talking mental health and kids in schools right now, but you mentioned water. There's transportation. There's a lot of issues that these guys have to focus on. And really, you are all the experts. You're the experts about what's going on in the community, what's working, what's not working. And I don't think I'm speaking out of turn to say is that you're relying on this. It is a partnership. It's a two-way street. So for us to have good, sound state policy, we need to have that accurate information coming up so that they can make the good decisions that they want to make, that we all want to make as a state. So just want to encourage you that they're great people, great staff. They welcome you to reach out and share with them what's going on in your neck of the woods, within your programs, within the kids and the families that you're serving. And so just wanted to encourage you. I also wanted to say, too, and I'm sorry that I didn't mention in the beginning, explain more about my organization, Texans Care for Children. We are a nonprofit, nonpartisan, state policy advocacy organization that, again, is really looks to community members to help identify what are the issues that are affecting our children and families in the state, and trying to identify what are some ways that the state can, help our kids and families prosper, knowing that it is a vital piece for a successful state. And so I also want to put myself out as a resource, my organization as a resource. Again, if you ever have some concerns or not only concerns, knowing that what is working, what are some great things that are happening within your programs that you think could help inform other areas of the state. I'm happy to work with you to help you meet with some of the legislative offices or the state agencies, again, so that we can share your knowledge and your expertise with the folks that are making decisions. So I just wanted to put that out there as well. I think we have about 15 minutes left on time. So what I wanted to do is open this now, if it's okay, up to some questions from the audience.
These chairs are really comfortable up here.
This one be better for you, maybe?
No, I'm good.
Okay.
I'm perfect.
Yes.
You guys are doing an excellent job advocating for mental health for the state of Texas, but what are your colleagues' feelings around it? Where's the stigma? And because stigma is one of the major issues in getting more funding and more programming. Texas is ranked, as you know, almost the bottom of the barrel where we rank with our programs, our funding, and everything for mental health. So there has to be some contention there among your colleagues. Can you describe that?
Just an opportunity to restate the question so that we could pick it up on the video. Is that you both are speaking about the need and the priority for mental health in the state, but what are some of their thoughts or feelings of your colleagues, recognizing that as a state we are ranked at or near the bottom in terms of mental health spending, as well as issues that still linger around mental health stigma?
I'll address that. You're right. There's issues that some members of the legislature tend to want to focus on more. Texas and Texans have always kind of put forth a vision of low taxation, low regulation, individual success, and pulling yourselves up by your bootstraps and working hard, and that's been successful. Texas is successful based on those policies. But mental health is a special subset of that. Healthcare in general is something that many legislators are not familiar with, other than being potentially patients. And so I'm one of 3 doctors in the Senate, and I think there are 3 in the House. There are a number of nurses as well. There's a small subset that have to advocate and understand the healthcare policies and try to explain and get policies that are right for the citizens and the people of Texas. And sometimes that's a challenge. But this last session in particular, in reference to mental health, it wasn't that big of a challenge. I think most, if not all, legislators understood that Texas did need to address some of the pressing issues of Texas, and that included mental health, that included women's health, and that included infrastructure that I mentioned earlier. The mental health portion, it was a significant amount of enhanced funding with almost a session review of all the mental health policies that are in place, and that extra $350 million, up to $1.7 billion, I believe, in the Department of State Health Services through the strategies that concern mental health, is a significant recommitment to addressing some of those issues. Because it's not just that individual; it also is seen from the conservative side, of which I am part of, as something that clogs up our jails and clogs up our emergency rooms. And if you can't sell them on the individual side, sometimes you can sell them on these other issues too.
What are the thoughts in the House, yes, that you see?
I think it was much more sympathetic this time around. Even one of our members is the state president of the Autism Association, and he was very vocal. He brought his son and introduced us all to him, who just got married. as a success story for someone with autism, and he gave us all these little pins to wear. They look like the little survivor type things that you wear, except this was all like puzzle pieces. We have another member. In fact, we have a Williamson County rep also who has a son who's autistic. So there's a much more of a sympathetic thing. And again, personal experience makes you aware. And plus, I think it's our role, or my role, I should say, as a House member, because there's so many of us, to be for sure personable, develop relationships so I can persuade and influence or share information about things. So I think this summit was much more sympathetic, people sharing their personal stories, bringing their successful autistic son to let us visit was awesome. I have a nephew who has autism, so for me that's something personal as well. And then secondly, because of the terrible shootings that we've had, and I think most people were realizing the problem wasn't with the Second Amendment and the guns. We were like, this young man should have had help. There was no intervention for these gentlemen. So, or what could they have done differently? So I think that also made an awareness that we need to address mental health issues. So I think this session was actually much more sympathetic and awareness.
I'm curious, do you think that will carry over to next session or subsequent sessions?
I think that you're influenced by the most recent events, obviously, and some people it becomes less of an issue as the more current events take precedence in their mind. I think for some of the policymakers, myself included, I have a deep concern about mental health issues, and I think that obviously that will continue in my case, and I think that will continue for a large number of the members that make the policy decisions in reference to mental health. That, however, is obviously tempered and colored by how our budget looks, and I can tell you that Texas and the legislators that represent you continue to want to have a fiscally prudent picture that addresses the priorities of the state in a responsible manner with your tax dollars. And so if we have another economic downturn, that will obviously picture that as well. Right now, we are riding high on our economic success on some of the policies that I alluded to earlier and through the increased oil and gas. We, in Texas, but also particularly in Central Texas, are the sweet spot of the sweet spot from a national standpoint. We should be all thankful for that, and it's something that economic prudence of making sure we don't spend all our money, have some back in reserve, continue those policies is very important because it does color how each session goes. To have some backstop in reference to how much money we have in the bank in reference to our rainy day fund, our ESF fund. We're the only state in the nation that has over $1 billion in our economic stabilization fund. Only state in the nation. And those are, I think we manage our money well as a state and as an entity. It's not always what everybody wants, but I think long term it's the right vision and the right policy for the state and for our future and for our children and for our unborn children.
Thank you. Are there any other questions? Yes.
For Representative Farney, you mentioned something earlier about legislation for training regarding the educator certification programs. Can you elaborate a little more on that? Because one of the discussions we had in here yesterday was that typically in these prep programs that educators or potential educators are taught how to teach that kid that doesn't have any barriers, or the ideal student that's going to come in is going to learn and not going to have any issues, but in reality what we're seeing are a lot of kids who do have issues, and perhaps there's not necessarily a focus on the preparation programs in addressing the needs of those children. Can you talk a little bit more about how our prep programs can really focus in on these kids that do have issues?
I do. Thank you. Yes, and I do think that's important to help our new teachers to be aware of some of those indicators as well. There were two bills, or Senate Bill 460 by Senator Dewell, and that one was requiring educators to receive instruction on detecting mental health or emotional disturbances as part of their certification. That's the one I was referencing. So if you want to look up Senate Bill 460, that'll give you more. I happen to have it here with me, but it's kind of lengthy. So, but I do have it, and I'll be happy to actually share this with you if you want to have this. You've got one too?
I think I could also, because I know that I was one of the organizations that was promoting this bill. I think I see it as a first step. It is a first step to, so I think it's just going to be basic information that is going to be shared or provided with teachers that are going through the educator certification program. It's not going to be as extensive or in-depth as really probably providing the strategies that are needed to effectively educate kids that might have some challenges. But it's a first step, not a magic bullet. And I believe now that the process is probably going on to say, well, what exactly will that information look like? So unfortunately, it probably won't get to the issues that you referenced from an earlier discussion, but it at least started the process where there's going to be some level of awareness that is happening in the educator certification program. And then to speak to the other bill that would require training for educators that are, already, in the field. Again, it's a simple, maybe 1 hour training, could be done on video. And again, looking at the warning signs. But I think what you're speaking to is just shows that there are some other opportunities that we have as a state to better prepare our educators to meet the educational needs of all of our kids, those that are typical learners as well as atypical learners.
Could I say one thing?
Sure.
Something else I think is important is we want our teachers to have to be able to use common sense about things. I'm sure you know I'm not a fan of zero tolerance policies because to me it's zero thinking, no common sense applied. For instance, a little boy who had a Pop-Tart and chewed out the shape of a gun and turned it towards another child, he had to go to alternative school. That's ridiculous. So like in rural areas where there are hunting is prevalent, I think, if a student wants to draw a picture or bring a picture of him hunting with his parents, that's not to be considered, oh, this child's violent, or this child has thoughts of violence against something. So there should be, at the local control area, the local school districts, to be able to also make sure their teachers know hunting is prevalent in this area. Don't worry about that if they're talking about that. But if it's something they're depicting, an act of violence, that's different. So hopefully that's a part of it, to where they will be able to find a balance, a reasonable balance, to think and to reason, to know the child, to visit with the counselor, and to make the individual choice in that school district.
Any other last-minute questions? We have about 1 minute. No? Well, I just want to, again, personally thank you all for the work, for not only coming out here today, but also the work that you did this past session for students in mental health.
Thank you. Thank you for allowing us to be here.
I wanted to touch on a couple things. Number one, in section 3 of your binders, there's a form for the mental health first aid training that's offered through Bluebonnet Trails that has contact information. So if any of your districts want to contact them, they can provide that training. Secondly, I wanted you all to know that a lot of us in this room are members of the Children and Youth Behavioral Health Subcommittee of the Mental Health Task Force here in Williamson County, and our goal will be to get you some policy recommendations for this next session. So we talked about that some yesterday. And also for you to know that the people in this room are working really hard to address youth behavioral health issues and how we can do better in our schools. So thank you all so much for being here. We appreciate your time. Promise to get you a better stool next time. But thanks for all that you've done in this session and in all sessions to support youth. We really appreciate it.
Thank you, man.
Thank you very much.